I'm Dr. Wanyoike Gichuhi. I'm a consultant obstetrician gynecologist and a fertility specialist and a senior lecturer in the Department of Obstetrics and Gynecology, University of Nairobi. So what medicine entails, for those who are interested in a career in medicine, is first you have to pass the basic exam, that is the secondary exams, and then you join in universities. Now you're privileged, you have many universities that you can be able to join. Among the few, you have Nairobi University, Kenyatta University, Moi University, Maseno. They're quite a number one can do the field of medicine. Medicine entails, depending on which university you join, taking 5 to 6 years. It's quite an extensive program because in the first 2 years you're doing the basic, what you call basic sciences. You're doing understanding how the body works, understanding the anatomy, that's the structure of the body, because it is very important to understand, to know the normal before you go to the abnormal. So once you understand that, then you go to the abnormal. That's when you reach 4th, 5th year and 6th year, you're going to do pediatrics, gynecology, surgery, psychiatry, surgery. You do all the discipline together because you need to understand it. So for the undergraduate, what you're going to do is everything, all the disciplines you're going to do them, and you're going to end up with getting with a bachelor in medicine and bachelor in surgery. After that, you have to subspecialize. You have to do internship. Internship is where you go actually to the hospital, work under supervision for 1 year, then you're recognized as a doctor, but now you're just a general practitioner, what you call a medical officer. Then after 1 2 years, now you can go for your subspecialty. You have to decide whether you want to specialize in surgery, whether you want to specialize in gynecology, pediatric, neurosurgery, kidney specialist, all those disciplines. And that's where you make a decision now. And depending on one experience and what you want to do, then you decide what to do. And then you have to come again for the master's program in your area of specialty. As I've said, it could be gynecology, could be pediatric with the child, dealing with the children, could be surgery, could be neurosurgery, could be orthopedic surgery, we're dealing with the bones, could be the general medicine. You become an expert in endocrinology. Once you make a decision, then you have to come back for 4 years to study that program. Again, you can do it you still can do it in the local universities, but this program now you're doing when you're working. So most of the time you may have an income, but it becomes a bit challenging because sometimes you don't have sponsorship. But it's very important to subspecialize in medicine because it becomes a very, very specialized field. After you finish your 4 years still, you come back now, you are a consultant. You become a consultant in your area that you have specialized in. Or you become a specialist. Again, there's still subspecialty. Like I myself, I'm done obstetrics and gynecology, and then I've done subspecialty in infertility. And that I did in masters in UK for 2 years. So again, you can do it locally or you can do abroad to gain more experience, then you become an expert. So medicine requires a commitment, is a long-term process. Eventually it pays, but it is not an overnight. It requires learning for a long time. Even when you start practicing medicine itself, you still have to go for refresher courses because there are new development, new ideas, new concepts coming to be, new modalities of doing surgery which are coming to do, new technologies involved. So it's a learning process throughout. I've been in the field for the last almost, now as a doctor, that's how many years, almost 30 years, and I'm still learning. I'm currently doing my doctorate, my PhD in endometriosis, so it's a continuous learning process, but it pays itself. And you enjoy actually when you get good outcome. When somebody comes is sick, you perform surgery, you give medicine, and they have full recovery. There's that career satisfaction. And for whatever young people, what career you want to do is not a question of money. It's first get career satisfaction in what you're doing, and then money becomes the secondary, not the other way around. We must inculcate that culture of excellence in Africa. And we must be proud of ourselves, whatever you do, whatever career you're in, be proud of yourself, whatever you're doing, and I think that's where you're failing. That for you to be a good doctor, you must be proud of your work, your outcome. For you to be a good engineer, I'm not an engineer, you must be proud that this road I'm going to make is good and it's going to last for long. We have to be proud of ourselves and the work that we do. Sometimes you can get quite frustrated because especially when in the early times in your career, when you have to wake up at 3 o'clock, 4 o'clock, and you go to the hospital, it's very tiring. When you have to work over the weekend, Sundays, it can be very, very tiring. When you have to spend many hours learning, it can be very tiring. So sometimes you feel like giving up. But most universities have good program of mentorship where you're encouraged. And so long as what you're going to, and you feel motivated and the people to motivate you, then actually you end up achieving your objectives and goals.
Do you feel the education about medicine in Kenya universities is adequate to bring out good doctors in Kenya?
Yeah, it is adequate to bring good doctors, but like in any other field, there must be interaction between the doctor, the student, and other universities. So we have programs where people can go outside. And that happens all over the world. Whether you go to US, when you go to US, you go to Europe, there's a lot of interchange programs between students so as you can get different expertise. Because if you were to get somebody who is from abroad, from Europe, and comes here, he cannot be able to treat malaria because they don't have it. So there are diseases which you won't find in Europe, you find them here, and vice versa. So there are conferences, there are workshops which one must attend to get to broaden the experience. So the facilities are adequate, but again, we must recognize and be in cognition of the fact that actually the developed one is more advanced than us. There's some technology you may get in the developed country which is not with us. So you need to get exposure of that technology which you find abroad.
And beside maybe wanting to give up while studying, what are the other, what would you say are the major challenges you face as a student of medicine?
The challenge which you face initially, actually, the financial challenge can be there, because if you are going to train yourself very early and you're not able to practice, so finances can be a problem sometimes. Two, training abroad can be quite a challenge because of the use of the finances and also the time. So those are the factors. But so long as you choose the career that you want to, and I have said before, it's not about money, it's about what you're interested in, then the challenges become less. But if you go for a career because of money, then you can get really frustrated. Yeah.
But some people, when like maybe in high school or after high school, they get to a dilemma where they are stuck like with very few or career options, or they just wonder like, how do I figure out what I'm going to pursue? For you, it seems, I don't know whether, but it seems like it was an easy choice. How do you go about deciding what career you need to pursue?
I think this has been a very big challenge, especially for the young people. But what we have, or what we had in schools, was what we call career talks. And that's what I encourage schools to get. You get people to get as many talks as possible. You get an engineer, you get a doctor, you get a lawyer, they all give career talks, and have to be sober career talks. So by the time somebody is coming, knows what you are. What we're having now in the medical school, they have many students dropping off because they don't know exactly what they're coming to, but that you have to put many hours. The studying is more when you're in medical school than when you're doing the other careers. You have to put more hours, and even when you start practicing. So career talk can be very, very healthy, where people are well informed of what they are going to, and the implication as far as the time is concerned, and in future, the outcome, depending on what they want to be, is very, very important.
And other things that you learnt about medicine while you had begun the field, like studying, that you wished you had learnt about when you're in high school or before?
Yeah, precisely, because when I came to do medicine, I thought this is you're going to have a lot of time, because you think it is very easy. It's like working 8 to 5. No, medicine is not working to 8 to 5. You have to do. You're going to do about almost in a week. You're going to do 50 hours by the end of the week, and you're working every day, Monday up to Sunday. So you find it challenging. Even public holidays, even over Christmas, you're working. That's something that never came to my mind, that it can be quite challenging. Two, you can be called at any time to come and attend to that person. And three is the money might not always be there, because if you call someone who has an emergency, is the life which comes first, is not about the money. And for the facilities can be very limited. In the government hospitals, I worked in Kenyatta Hospital for the last almost about 20 years, but facilities can be quite limited, so they can be quite frustrating. You want to do a good job, but the facilities are not there, you see. The same thing you see, like, sorry to say, in our roads. You find our roads, you get some public hospitals, even the private hospitals, they're not really up to date sometimes, some of the equipment. And if the equipment are there, they're very, very expensive. So using that on a patient says, I cannot afford it. That's the other factor with medicine, actually. The last point is the patient is there, you know how to manage the patient, the facilities are there, but the patient themselves cannot afford. So you get frustrated as a physician. I can help this person, but they cannot afford. And the public hospital doesn't have these facilities. So that's where the really frustration comes in. The patient is telling you, really, listen to me, you have the knowledge, you have the technology, but they cannot afford. Even in a public hospital, there are no facilities. Yeah. So primarily, I think it's a problem we have in the society, because you see, health is usually a major issue in the developed world, be it in Europe, be it in America. People think about health as a very important part of the society. They think about in politics, but here it doesn't seem to be a factor, so it can be quite frustrating.
To students or young people who just look at what is happening in media, when the media reports about how government is mistreating doctors, they're not paying them in time, they're not giving them the necessary resources they need to do their work. Students can give up when they want to do medicine, but they see the state of medical officers in Kenya. What would you advise a young person who is watching all this and is considering giving up on the course, on the career?
Well, I think it's rather a political question. Is one, as you said before, is what your interest. If you want to be a doctor, first is be a doctor, isn't it? And I'll bring a quotation from the late Dr. Martin Luther King. If you want to be a sweeper, be such a good sweeper that somebody will say, there lies a good sweeper. It's my conception, if you do whatever you're doing and you excel in it, you're going to actually, even financially, you're going to excel. You're going to get money. If you're very good, people come to you. So even if it's in the field of medicine, the top 10 physicians or the top 10 category of doctor will still get clientele. You get my point? So you may get frustrated that the employer who is not paying you, but if you're very good in your work, still you'll get some money. Because the doctor, one thing they have done, the government, one thing you can give them a big plus is you can work in the public hospital and still have your private clinic, isn't it? So you can supplement your income. So it's not frustration throughout, as people say. I agree, for young doctors who don't have a private practice can be quite frustrating, but there's a light at the end of the tunnel, is that you can practice in the public hospital and you can have your own clinic or your own hospital where you can practice it. And finally, medicine also is an art. Sorry to say, it's become a business. If you're not really satisfied with the public sector, then you can go, actually, there are doctors who have their own hospitals and they're doing very well. Very young doctors. And they're giving service to the people, because the service, you can give it whether you're in the public or whether in the private. So that's the biggest advantage, again, you have in medicine, is you don't have to be employed. You can employ yourself. So there's still hope on that line. And we still need expertise, good expertise in this country. That's what I like to encourage them, that there's still public and private, and you can actually employ yourself and you can train yourself and excel in your area that you're going to work. And we know very well all these services are needed, not just in major cities like Nairobi, even the small towns, they still require good services, especially with this issue of the county.
You pointed out a challenge about time, lacking time to further your studies. But that also insinuates that it may be difficult to balance time for work and family and other important things to attend to. From your experience, what are some of the tips you can share that one can use in navigating through that challenge?
I think the most important thing is, we have said, is identify what you want to do, because that's very important. People spend a lifetime knowing what they want to do. You see it, someone is 20, 30, 40 years, they don't know exactly what they want to do. The most important in life to identify, what do I want to do? This I want to do. Second point, how do I get there? I have financial problem. That is true. You may have financial, but still you're going to get away. Commitment. You get it? Because now you're having people who are willing, even sponsorship. That actually, once you've committed this want to do, then sponsorship can even occur. Not only the government sponsors, now the counties are sponsoring, missionary hospital sponsors. Two, even the parents now sponsor their children. Okay, there's some people who may have a problem, but we have really people who have come from very poor background coming out. So long as you know where you want to do, so long as you know your goal and your objective, then you're going to get there. If you're looking for something to make you fail, or if you're looking for obstacles, there will be 1,001. I don't have money, I don't have time, I come from a poor family. But once you achieve your goal, it may be difficult, but eventually you're going to get there. That's the most important thing, and committing towards that goal and focus towards that goal. 2, 3, it's an investment. Career is an investment. It's like that somebody somewhere there who is building building a building and is putting stones every day and whatever building. Career is an investment you're doing, and it's going to pay itself at the end of the tunnel. So instead of buying that shamba, that piece of land, that quarter or an eighth or a land or whatever, why don't you invest in your education? If you're a doctor, in your subspecialty, and it's going to pay itself. Personally, I've had training literally almost at University of Tel Aviv. I've been to University of Bologna in Italy, that is in Israel, University of Bologna in Italy, University of Kiel, Germany, University of Stellenbosch in South Africa, University of Leeds in UK. And University of Stellenbosch in France, I've been all over training myself because it's an investment. I enjoy doing it, and I've seen the results.
Maybe you could have last words for the young people out there on whatever thing you'd want to say.
The most important thing is you have to decide what you want to do. Right when you're leaving school, you have to make a conscious decision. This is what I want to do. To the young people, you don't have time. Most of people think at you're 18, 20, you have time. You have no time. There's no time. That's my advice. You don't have time. It's never too early to finish your career. It's never too early to invest. It's never too early to actually plan for your retirement because you don't have time. People say you are 18 before you know what's happening, you're 50 years old, and you have done nothing in your lifetime. I think that's the biggest problem we have when you're young. We think you have no time. The same problem when I was in college, I was saying I'm still very young, I still have time. Then the reality, you finish your college, and you find that the government was paying us, I don't know, 6,000 a month. Then the reality is, so you don't have the time. That one is, this is I want to do, commitment. This I want to do. 2, you pursue it. 3, you don't have any time. So the sooner you finish, the better. Even that PhD, try and do it, master's PhD, do it when you're in your 20s, not when you're 30s. And the 3 is very important to actually have career progression when you're 20s before you get your family in your 30s, because now that can really hinder you, because you have to get a house, you have children, you have a family, you have to go to school, you have to pay education. It becomes very difficult. So it's much easier when you're in your 20s to commit yourself in what you're doing, especially as far as the career development is concerned. And for the career progression never ends. You may find yourself that you're actually in the 40s, in the 50s, but you can still do your master's, you can still do your doctorate. There's once I went for training in Greece, and there was a gentleman who was 67 years old training. 67 years old, I can't believe it. So time is, you can train yourself, and we've had people here in the 70s getting their PhD. So it's very good you do it early, your training. However, even if you're old, you can still pursue your interest. How old is Biden? And he's the president of states. Yeah, you see, I don't know what happened to the light.
The batteries.
Okay, fine.
Yeah.
Mm.
Thank you so much. I appreciate your time.
Okay, fine.
Yeah.
Okay, all the best.